These movements are not meant to diagnose or treat medical conditions. If you are having symptoms or pain, please visit your local chiropractor. This video is brought to you by Brewerytown Chiropractic. Sharp-shooting pain into the legs, often known as sciatica, originates in the lumbar spine. The nerves exiting the lumbar spine are the ones that communicate between our brain and our legs. When we have a disc in our lumbar spine that is bulging or herniated, it can put pressure onto that nerve root. Not only will you feel pain into your low back, but you will most likely feel sharp pain into your leg that can be very severe. To correct this issue, we will need to move the spine in a way that will help guide the disc back into its original location. Opening the front of the spine will shift the pressure on the disc from front to back. This change in pressure will help guide the disc off of the nerve root back towards its original location. As a patient is getting better, they may feel the pain start to come out of the leg, and it may even become increased pain into the low back. But don't worry, after the symptoms are no longer in the leg, getting rid of low back pain is the next step. The first part of this protocol is simply to lay on your stomach. If laying on your stomach increases your pain in your back or your leg, or is too much pressure, try sliding a pillow under your stomach. As long as there is no increased pain, numbness, or tingling, you will lay in this position for 5 minutes. Laying on your stomach with the support of the pillow is the only movement you will do until you can lay on your stomach without the support of the pillow. If you can lay on your stomach without the support of the pillow initially and without it increasing pain, numbness, or tingling, you can skip the first step with the pillow. Lay in this position for 5 minutes. If you are experiencing increased symptoms, simply stop the exercise or revert back to using the pillow. The next step will be to prop yourself up on your forearms, extending your low back. Be sure to not let your hips come off the ground. Hold this position for 1 to 3 minutes. If you are experiencing increased symptoms, simply stop the exercise or revert back to laying on your stomach. The final step in our protocol today is to use your hands to lift your shoulders and fully extend your low back. Remember, your hips must be touching the ground. Gently lower yourself all the way to your stomach and then prop yourself all the way back up to full extension. Do this movement 10 to 15 times. If you are experiencing increased symptoms in your back or your leg, simply stop the exercise or revert back to our last position, propped on your forearms. Remember, our main goal is decreasing symptoms into the leg. That is the first sign that this process is working. When the exercises are completed, we are looking to see if there is a decrease in leg symptoms, even if it comes along with an increase in low back pain. But don't worry, low back pain leaving the body should be the next step.